Hi, my name is Haley, and this is my presentation on discrimination in mental health. The first form of discrimination is with disabilities. There have been studies that show a report was done that shows doctors often turn away patients because they don't want to deal with a disability. Many doctors were interviewed and admitted anonymously that they turn away patients with disabilities, and they often find patients with disabilities to be lacking, they're a burden, they don't actually, they're very stuck up, and it's just a lot of discrimination, open discrimination to people with disabilities. Many doctors admitted that they told their patients or future patients that they weren't accepting anyone new purely because of the fact they understood that they had a disability and no longer wanted to work with them. They also admitted that they lack the skill and accommodations that are necessary to deal with someone who has a disability, which is another big issue. Obviously, the long-term effects of this are going to be the fact that they don't have access to care, which everyone should be able to have access to healthcare. It's not fair that we're lacking these accommodations purely because we don't want to work with someone and we think that it's just whatever. And then also the mistrust that comes with dealing with healthcare providers. I mean, people are constantly being turned away and they're losing their trust in people that they should be trusting to help them and make sure that they're healthy. So along with that, there are rights provided for healthcare. Obviously, the government has funding to provide accessible care, but even doctors admitted that they don't use the funding to work with certain disabilities, and usually they don't create that accessible care. They just do whatever they like with the funding that is provided, which is another big issue, because if we have the rights to accessible care, why aren't we being granted that accessible care? Along with LGBTQ students, one study has shown that many have faced discrimination in schools. They're often bullied and harassed, and teachers are not conforming to the preferred pronouns of their students. And even students reported in a school that they were hearing staff use homophobic language, which is unacceptable in any setting, but no child should have to come to school feeling unwanted and unheard and discriminated against or having that form of harassment. The long-term effects of this are the increase of suicide rates in middle school and high schoolers. Many LGBTQ plus up to 30% had said that they had idolized suicide, which is much higher than the 7% of non-LGBTQ plus students who said they had also thought of suicide. There are laws protecting the LGBTQ in schools, but not every state has them. So 19 states out of the 50 have discrimination laws based on gender identity and gender orientation. Not every state has both. There's only 2 states that actually protect gender orientation, and then 25 of our states, so half of our states, have no laws protecting discrimination for LGBTQ in schools. So then with current discrimination, how can a healthcare provider create good care and make sure that their patient is actually taken care of? Many clients with disabilities struggle with accessibility and the mistrust that comes with dealing with providers that are often turning them away and lying to them about why they can't provide care. Care should be accessible, and if you are working with someone in healthcare, they need to have resources that can be provided. If they're not able to have accessible care, they need to have someone that can provide that care. And then over time, building that trust and asking questions to make sure they feel heard and understood, and they're not feeling left out of the loop with that as well. Continued education is always going to be important when working with clients with unique disabilities. Everyone is different, and so when something comes up that the healthcare provider might not understand, it is important that they do the continued research to make sure that they are well prepared to work with that client and make sure that client feels understood just like every other client does. With LGBTQ individuals, they are often harassed, and many healthcare providers, along obviously with the teachers that we're seeing, ignore their pronouns. So it is important to ask about preferred pronouns and ask about gender orientation and make sure that there's an understanding there. When unfamiliar topics come up, the healthcare provider should ask questions. There's no reason that we can't continue to educate and grow even in that client provider setting. So it's always important to ask questions. It doesn't have to come from a place of judgment, but just asking, how does that work? How is this dynamic continuing to grow? So that there is a better understanding. And then with that continued education, once the time is up with that client, making sure to continue to grow and learn about those important matters. And that will always be important no matter who they are working with, whether they have a disability or come from an LGBTQ background or have both. Like, no matter what, continued education is always going to be what's best for these patients. There's never a point in time where every counselor is going to know, or every healthcare provider is going to know everything. They need to continue their education and find pride in their ability to grow and expand their knowledge to be the best for their clients. And those are my resources. Thank you.